Oparanya anazungumzia mikakati ya kaunti.
By the health CS. This has informed the additional measures announced by His Excellency the President on Monday, restricting movement in and out of certain counties to contain the disease. Today, I address you on the progress county governments have made in the effort to contain and stop further spread of coronavirus disease. And you can see today, because of the restriction of movement, I've come alone. Previously, I've been flanked by either 3 or 4 of my colleagues. Now, one, we assure the public that counties have put in place measures to ensure that normal service provision to other ailments is not interrupted because of the coronavirus. As you know, people continue being sick. So, as county government, we continue to provide services to Wananchi on those other ailments. Comprehensive care clinics are open and accessible to Wananchi who require other services. Immunization services for children are continuing without interruptions. Patients with chronic conditions such as cancer, diabetes, HIV continue to be attended to in our health facilities. We encourage Wananchi not to shy away from seeking medical attention if they have other ailments. Counties are doing what is possible to ensure the supply of medicines is not interrupted during these hard times. On staffing, to address the gaps in human resource, the national government is supporting counties and is going to give them conditional grants to recruit additional 5,500 health workers in different cadres to post manpower at all health facilities. As I talk now, county public service boards are carrying out recruitment of this staff to report to their workstation by 16th April 2020. On PPEs, provision of personal protection equipment for our health workers is top priority for county government. You know, this is a war, and our frontline soldiers are the health workers and the people who are in security. So we must make sure that these people are actually protected. I therefore wish to commend the efforts of county governments in equipping PPEs for their staff, although there is a challenge that they are unavailable, and we are hopeful that the measure the national government is taking to make sure they are manufactured locally and also they are imported, they will be available. The Kenyan Bureau of Standards have certified the quality of PPEs locally produced. There are some SMEs in counties already producing these PPEs. We urge the national government to provide adequate PPEs for security personnel so that they are also able to carry out their responsibilities without being infected. As I said, people in healthcare, those working in the health facilities, and the security personnel, there is a danger unless they are protected. Testing for COVID-19. We laud the efforts of the national government to operationalize additional labs to boost the testing capacity in the country. This will be very useful as the disease spreads very rapidly. Quarantine facilities. Through county emergency response teams, all 47 county governments have identified in additional facilities to serve as quarantine within their counties. These are mainly boarding secondary schools, we wish to assure the public that all measures have been put in place to ensure that the identified facilities are decontaminated and safe for children's use when schools reopen, when they will reopen. Buildings will be provided for use and disposed of according to the existing public health regulations. On water and sanitation, most counties have purchased water treatment chemicals for water companies and also shouldered the responsibility of providing clean drinking water to needy communities. County governments are also providing sanitizers to the public for free. Other counties like Mombasa County are now constructing walk-through sanitizers, machines that clean up the whole body and not just for hands, to deal with the issue of social distancing at the ferry. On face masks, county government in collaboration with the KEPS have directed their SMEs to start producing masks. The border riders have been provided with masks through the county governments to ensure their own safety and the safety of their passengers. On food security, county governments have already distributed seeds to the farmers, because we must have food, whether we have this problem, but we must ensure there is food available to our people. So the county governments have already distributed seeds to farmers to ensure that we address the issue of food security. The farmers are receiving support to grow food for short, mid, and long term. We urge the National Fertilizer Subsidy Program under the Ministry of Agriculture to ensure they deliver fertilizer to the farmers on time. County governments, in collaboration with the national government, continue to put adequate measures to manage locust invasion.